I'd like to welcome you to World Mental Health Day. This day provides an opportunity for global mental health education, awareness, and advocacy against social stigma.
When it comes to our staff, we want to make sure everybody has good health, and that includes good mental health, and that if there is an issue, we want to be part of that solution.
I'm pleased to be here to support collectively our mental health and to just be me, Tracy, without a label or the stigma associated with my mental illness. I'm here to introduce Tammy Whelan, our guest.
1 in 5 Canadians will experience a mental health problem or illness in any given year. Everyone has mental health. And some days are good, some days are not so good. And when our not so good days turn into weeks or months, years for some, because they're not reaching out to get the help that they need, this is when it can turn into an illness. Stigma plays a huge part in people sharing what they're experiencing and what they're going through. We have had a huge uptake in organizations like yours who care about the mental well-being of their staff and want to help and want to offer resources. This slide I love. I have it hanging because it reminds me that I need to do more than one thing to look after my mental well-being. We need to look at our emotional, our physical, our intellectual, our spiritual, our occupational, environmental, and social wellness. All of these things are pieces to a wonderful pie. And sometimes you'll notice in life that you may be nurturing a few of these things, but you forget about a couple. And I'm going to suggest that you don't wait till that stressful situation to practice self-care. I'm going to suggest that you actually practice self-care on a daily basis. What I really recommend is thinking about 15 minutes before you start your day and 15 minutes after. So 15 minutes before, 15 minutes after. What could you do for yourself? So employee and family assistance programs, they are offered to you, they are available to you. And I think not enough people are aware or know that if they get assigned a therapist through the EFAP program, that you can change it.
You know, I think it's an important piece to recognize if you're not clicking with your therapist to, cut ties and try to find somebody that you do feel supported and feel comfortable with.
So my message for this entire session is that you can do this. You can look after your mental well-being. You can ask for those breaks. You can give yourself permission. You can take a step back.
I wanted to take this opportunity to thank Tammy as well. Thank you, Tammy. And the resource group, Jason and Tracy, thank you so much for working with Andrea and us to put this together.
I'd like to end by thanking everyone who attended this event because, we are social beings and our mental health is tied up with our relationships. And I think by being here today, you demonstrate that you're not just concerned and you want to support your own mental health, but the mental health of your colleagues.
Thank you, everyone.
Thank you.
Thank you.
Bye.
So
well
much.
done.